You're listening to In Sickness, a caregiving podcast from the Negative Space with Allison Breininger and Justin Bima.
Good morning, friend.
Good morning. It's been a little bit since we've sat down and talked together.
It's been a long time.
Feels really good to be back.
It does.
Excited to talk to you this morning.
Yeah, me too. It has been a break, and we have been going through it over here, which is why we have been not doing the live recordings like this. But I'm so happy to be back here with you and talking this morning. Something that came up because, you know me, my brain's always going. So even as we were going through it, I was like, oh, that would be a good conversation. That would be a good topic. And so a thing that has come up for us in the last months where I have been in intense caregiving is the topic of respite.
Yeah.
And people just being like, Allison, it's beyond the make sure you're taking care of yourself. It went very much to are you getting respite?
Yeah.
Which is not something that in the past people had been waggling their fingers at me about.
Right.
But because I think this was so intense, I was getting a lot of that finger wagging. So I thought we could talk about, now that I've sort of personally experienced that and I hear a lot about it, thought we could go there today. So
that sounds like a great topic.
Will you kind of kick us off with what is the official definition?
Yeah. So if we want to look at respite and the official definition, so it's like a temporary pause, rest, or relief from something difficult, tiring, or unpleasant.
That's one way to put it. Yeah.
Yeah. It can also refer to the postponement of a punishment or obligation. So, but that a break from caregiving. That's kind of what it boils down to for our purposes, right? Sure.
I do want to later come back to that. It is a postponement of an obligation,
right?
That sort of addendum to it, because
for sure,
it doesn't go away. You know what I mean? It's just it's a postponement. It's still going. It's still happening. You still have to go back to it, right?
Yeah.
So later on we can talk about that.
Yes, for sure.
Yeah. Yes. So when you hear about respite and caregiving, what do you sort of think of, or what is that, in your either what you've experienced or what you think of or have read about, what do you think that looks like?
Yeah. So I think typically when I have heard someone talk about respite care, I think mostly of a professional service that can come in and either be with your person and care for them for a period of time. It could be, I guess, a day or a couple days, nothing long, or also potentially a facility that they can go to while you get a bit of a breather. It feels like I hear it in the context of, as you've kind of experienced, really intense caregiving. It's something that doesn't come up initially, right? It's once down the road, things get really intense, or if things are really intense right off the bat, maybe. But it's used as okay, you're exhausted. Here's a thing now that you're at this point, here's a thing you can take advantage of, right? And I have some thoughts on that it doesn't come up until later.
Right.
I don't know if you want to talk about that now or not.
Sure. I mean, I think that's an interesting, and we've talked about that so often here around burnout, right? Why are we waiting until, and often it's the caregiver themselves. And I myself, I am guilty of this.
Yeah.
That when you're not crispy burnt, you're like, I can do this. It's fine. It'll be more work to get the help and Right. And so you said it's when you're exhausted, maybe that somebody reaches out. And so how can we preemptively both offer this, but also preemptively make it the kind of thing that caregivers are able to say yes to earlier on instead of waiting?
Yeah.
And so you said it's for really intense things, but I also think about all our friends who come to support group, and so many of them it's that it's long, it's years and years and years of this. I kid you not that the other day we were talking about at support group, we were talking about time toxicity. And how much time do you spend caregiving? And somebody said, I think we should flip it and say, how much time do we spend not caregiving? And multiple people said that the breaks that they have during their day are, I kid you not, brushing their teeth. And one person even said, I feel like it's a success if I get to do the whole 2 minutes of brushing my teeth without being interrupted.
Ooh.
And I was like, oh, friends, that's a real low bar.
Yeah.
Right. So I think that part of it is, yes, if it's super intense, but also if it's this long, chronic, you know, and it's just been going on for years and your only break is brushing your teeth. Like what?
Yep.
Right. So I think when you said respite, yes, I think it is that. Like there are places where you can like bring your person. It can be a day or two, but it can also be like by the hour.
Yeah.
You can have people come in, paid people who can come in. It could also be though, informal.
Right.
Right. So let's say you lived in town. I wish you did. That would be amazing. But let's say you lived in town and you were like, hey, Allison, I'm going to come over and hang out with Sean for an hour or two while you go do whatever you want. Right. Like that also would count.
Yeah.
And I think there's, you know, challenges and positives to all of it. Right. But I think all of that can count as respite. Yeah. Yeah. Is this something back in the day when, you know, Sarah was bedbound and it was super intense? Is this something that you ever considered or people said to you or you took advantage of or?
Yeah, it wasn't something I ever took advantage of. It was something I certainly thought about for myself, that if that was possible, that would be wonderful to have a moment or some time to kind of relax a little bit. I think there were maybe once or twice, maybe not when she was at her worst, but where I like got away for like maybe a overnight thing. And I think Sarah's mom came and helped with Sarah while I was out. So there were a few instances like that of maybe some informal a little bit. But I think one of the barriers is when we are caring for someone for an extended period of time, we're the experts.
Yeah.
We know all the nuances of handling the different situations. We know exactly how our person wants everything.
Yep.
And it feels so daunting to have someone else step in and either try to document all of that, relay all that information to them, make sure they understand all that information, and then like the whole time in the back of your mind, you're like, are they doing things correctly? Right?
Right.
It's so hard to let go of the care for your person when it's someone that you don't, especially if it's someone you don't know, like in a professional setting. So there's that piece. The other is, you know, just if you can't, or, you know, knowing that they're just maybe not going to get the level of care that you can provide. And I think there's a lot of feelings around that's not okay. But I had written something down a long time ago, something around that but I could not find it for this, but it was something around like, we as caregivers, we have really high standards for caring for our person.
Yeah.
And not that they don't deserve that highest level of care, but that in times like this, like it's okay to kind of like let that go a little bit and let someone else just kind of handle things. And, you know, your person's still going to be there when you get back. And, obviously you want them to be doing well, taking care of them and meeting their needs. But like, as caregivers, we also, I think, are doing a lot of above and beyond. Especially when it's like for, you know, it's your spouse or someone that you're doing it for anyway. Right. So that makes it really difficult to hand over kind of that responsibility or that whatever it is. And I think when we've been caregiving for so long, and that's kind of when this comes up, or when it's just been really intense, like we are not in a state to lay all that information out there.
Right.
Or like if someone said, you know, okay, you should get respite to me in that time, like I would be like, okay, now I have to figure out, is there a service I can use? Is like, who is the person? Like all of the preparation.
How much does it cost?
How much does it cost? And that's just, you're not in the place to figure all that out.
Right.
And you've also like built the pathway in your mind of like, I'm the person that cares for my person. This is how we do it. This is everything. And it's just like so ingrained.
Yeah.
So I was thinking about this, and I think that one thing that could help is, okay, if earlier on when you're caregiving, if you can be comfortable letting other people in to help you with your caregiving,
mm-hmm.
both to kind of push back against the notion that I have to do everything myself.
Mm-hmm.
And so that there are people that at least have a base knowledge of what's going on.
Sure.
And so when it comes time that you need the respite,
sure,
there are people who already kind of
sure
have some experience there. And maybe it's like early on, it is something like, okay, someone's going to sit with your person for an hour while you take a walk.
Yep.
And just building that as a habit early on so that you can have people and resources when you really need them, right?
Well, and guess what? I wonder if, we've talked in the past about going like upstream, right? What can we do upstream to prevent this burnout? And so if you from the get-go are having people coming in and doing little pieces and understanding things, maybe it doesn't get to that moment of like, you know what I mean?
Right.
Because maybe you're building it in throughout. And so I have to share that so Sean had this major surgery at the end of May and came home from the hospital. And I have this dear, actually Megan Voss, who did the trauma episode with us, is amazing, and came over, and it took two of us like a whole evening and then a whole full day the next day to like organize all the things and put together a cart and all the, like all of the things. And then medical supplies were coming in the door and all of that.
So you're setting up a medical clinic in your house.
Yes.
Yeah.
Yes. We are suddenly all of the teams that were just coming in to the hospital are now me.
Yep.
Yes. And so it took two of us, smart, resourced women with a lot of degrees between us to figure this out. Right. So, but she's so great that she created a document for me and said, because I was like, my brain is tired, I need you to write all this down so that I don't mess something up because I'm so tired. I could and she said, I'm going to make this so not just clear enough for you, Allison, but clear enough so that when you get respite, you can hand this to someone.
Right.
So she planted that seed for me from the beginning and sort of tried to set up the systems for it from the beginning. Like, we're not going to do shorthand that you'll just understand. We're going to do this so that you could hand this piece of paper to anybody and it would be ready.
Yep, that's great.
And I appreciated that from the beginning. She planted that seed.
Yep.
Because you're right. Otherwise, it's all in your brain. And then you're like, oh, it's just easier if I'll just do, it's just easier.
Yep.
Right.
Yep.
And so, yes, if we can from the beginning. And so we did that. Like, my mom was over one day and I was like, okay, I want you to watch as I XYZ so that you could take over,
Yep.
And so having that and not waiting for the shoe to drop, because if we do this preemptively, maybe the shoe won't drop. Maybe we can keep ourselves a little more buoyant, maybe.
Right.
Yeah. Yeah. So I think that's a huge piece, is handing it over. And when you said, if we hand it over to someone we don't know, but I mean, there's different things. Like, if it's a paid person, you're hoping they're trained.
Yeah.
You don't know them, but you're hoping they're trained.
Yep.
If it's a family or friend, you do know them, but they probably don't have the training.
Yeah, right.
Right. And so there's some both ways that we have to go to. And you're right that sometimes it's just, to make this happen, I'm going to have to hand over the reins for a little bit. And I've done everything I'm going to do. And you know what I mean? And just, know that, like you said, it might not be the caliber that I do at 125%, but it'll be okay. You know? Yeah. Yeah.
Yeah. So as part of this, we asked for some comments from listeners on their experience with respite and all of that. And so, kind of touching on what we've just kind of talked about, this is from someone: I've used both private pay, respite care, and family members' offers that I could take a break and go for a walk or go to the gym. Sometimes the paid help did nothing but text on their phone. Sometimes they were conversational with my husband and helpful. Sometimes they called in sick at the last minute. Family members came through, but they were overwhelmed and stressed and let me know privately how they felt.
Ugh.
Respite care is hard to come by.
Ugh.
Yeah.
Both of those are just dang it. Right. So let's start with the paid people, right?
Yep.
And what we know is that people who have these jobs are underpaid.
Yes.
Right. As the person paying for it, it feels like we're paying an arm and a leg, right? But that's not going to the pocket of this person who's coming to your house. And so we know they are wildly underpaid. And that's why we know that there's so much turnover. And so we hear that a lot, right? It's hard to, first of all, find somebody. And then you find somebody and they're often unreliable, or maybe they're like, I'm not doing this job anymore, or I'm late or whatever, because we know they're really underpaid.
Yeah.
And so even if you go through all that work and then, like she said, the person didn't show up.
Yeah.
Right. Or the person is late, or they come and they're not really helping, you know, and certainly that's not the case for everybody.
Yeah.
But it can be the case.
Right.
And so, you know, I can see that it would be like, to a caregiver, like, why am I going to spend my time and my energy and my money on this if they're maybe not going to show up, or they're going to show up and not do it well?
Yep.
And I think the sentence that people just always come back to is, it's easier to just do it myself. But what have we always said in the past? Yes, and the pace at which you are moving, caregiver, is not sustainable.
Correct.
It's not sustainable. And so, yeah, you're right that it would maybe be easier in some ways, but to only have your teeth brushing be the only time your break in the day is not sustainable.
Yeah.
Yeah.
Yep. Because like if you maintain that pace, and just all along the way, it's easier if I do it myself, and you just do it all yourself, there may come a point when you have to take a break from caregiving, not by choice, but because of your health.
Yes.
Right?
100%.
And then it's like scrambling.
Yeah.
To try to figure out how to cover things and everything. And, you know, no one wants to be in that situation, right? And so I think you got to keep, that's something to keep in mind, that like, okay, in this moment, maybe it's easier that I do it myself, but like that's compounding over the months, years. And I think a fear of caregivers is like, what if something happens to me? Who's going to care for my person? Right. And so this is something, as hard as it is, that we can have some control potentially. I mean, we can't prevent everything. We can't predict everything, but minimize the our likelihood of being incapacitated at some point, potentially.
Right.
And being able to continue caring for our person.
Right.
Right.
Right. Yep. 100%. Yeah. Another person that sent in a quote said, there's nothing really available in my area. So I think that's true too. You know, like if you're in a rural setting or whatever, right? That can be even harder to find.
Yep.
And she said, anything resembling it requires so much planning and communication that it just isn't worth it. And it isn't free.
Yeah.
Right. So I know that, you know, I work closely with Iana Care, and they are one of these. So the GUIDE program, I think I've referenced that a couple times. So the GUIDE program is a new program through Medicare for caregivers of people who have dementia.
Okay.
And one of the components of the GUIDE program is $2,500 for respite care.
Oh, wow. Is on what? Is it annually or something?
Annually. Yep.
Okay. Yeah.
So yeah, we hear that and you're like, oh, wow. And so that sounds great. But this morning I dug into it a little bit to be like, so, but wait a minute.
What does that really mean? How much time
what does that really mean?
Yeah.
Well, how much time is it? But also, is it just like, here's $2,500. You do the work.
Yeah. Right.
To find the people, to pay the people, to whatever. And it kind of is.
Okay.
Although I was chatting with my Iana Care friends, and the beautiful thing is, like, Iana Care is there, like, as a support system for that. So if you're getting the help through Iana Care, they help you find the place. They help you submit the bills. But if you're doing it on your own, it's like, okay, cool, you get reimbursed, but only if you use somebody who's on their list. So you have to like go through the list and and then the paperwork and the submitting the bills. And so if you're doing it without a cool organization like Iana Care, what? You want more paperwork? You want me to submit this bill? And you only like, you know, I don't know how comprehensive the list is.
Yeah.
But it's a list you have to choose from. And so it's not necessarily, you know, like, So it sounds great on paper. And I'm glad that Medicare is thinking about that, and that they recognize, I mean, it's a way to say caregivers need respite. Thank you, Medicare. And I don't actually, I mean, I saw some costs, but it was sort of like, for like a 24-hour facility, it was like $300 a day. So, you know, how does that work out? 8-ish days in a year. Right. And so okay, that's a good start. But you know what I mean? And so it's just like, I'm glad that it's happening, but I just think that sometimes we're like, we fixed it.
Yeah.
We're giving caregivers $2,500. Like, but did we actually just give them more work?
Yeah.
I think maybe we did. Yeah. Unless they have these cool partners like Anna Care, right? You know what I mean? If it's just them on their own, what? I think that $25 would just sit there and just be like, what?
Yeah. So that brings me, I know we usually talk about supporters at the end, but
no, go ahead.
It seems common that people suggest respite care to caregivers, right? Like, have you taken advantage of this? Are you doing this? And it would be so much more helpful if someone was like, have you considered respite care? And how can I help coordinate that for you? Ooh. How can I help facilitate that for you? Because it is work and all of that. And like, it's just, if you just say, you know, here's another thing you have to do.
Right.
And it just is added to the pile. And it's another thing for you to stress about that you're not doing. It's like you're feeling bad that, I need to be doing this, but I can't, but it's overwhelming. And because one, it's acknowledging that it is more labor for the caregiver.
Right.
And two, it's just like, okay, I know that you need this. I see that you need this. I'm going to help you figure this out. And that would be enormous.
That was such a beautiful sentence that you said. It's so good because it's so true that it's not just like, it's like the equivalent of the, like, take care of yourself, which just pours it all right on them, as opposed to, I imagine that caregiving is really hard. I would like to support you in right? Like, I'm going to help you with it. Yes. 100%.
Because you can say you need respite care, and that's great. And it's like, you're just kind of like popping in, hey, I see you're exhausted. What about this thing? And then you're moving on, right?
Yeah.
It's just a quick little like check-in versus like, okay, I'm going to like walk this path with you. I'm going to help you. I'm going to be part of your community, part of your team. Yeah. And that's just, caregiving is real tough if you don't have some level of community around you.
100%.
Yeah.
Yep. Yeah. So an interesting thing that happened to me is that there were some people who were doing a little finger wagging at me.
Okay.
And who were saying, and it was kind, because I could tell they were even trying to take my own words. They were saying, you need respite.
Yeah.
You're exhausted. I'm going to come to your house. I will come there. I will do this. I will do that. You could go take a nap. You could do that. Right. And I feel like I have probably told people to say exactly that.
Yeah.
But here was the twist that I think is a really important part of this conversation, is that this was a person that I know from my past. Sean doesn't know at all.
Right.
And so Sean was like, oh, I'm sure it's a nice person, but I don't feel well. And I don't really want a stranger in the house. And that ended up being a whole complicated puzzle piece of this.
Yep.
Is that even there was a good family friend who graduated, and I really wanted to go to the graduation party. And so I said to Sean, I would really like to go to this. I'd really like to be gone for these couple of hours. Who would you feel comfortable having in the house? And certainly it wasn't, this wonderful, kind person who offered, because he didn't know them and he doesn't feel well. Right.
Yeah.
And so, but the interesting thing is, like, the list was really short. It was basically just his brother.
Okay.
And we know a lot of lovely people.
Yeah.
A lot of them. And I was like, what about this person? What about this person? But I mean, we don't feel well, And so it turned into this, like, where he was like, I mean, I guess it would be okay, like, if Adam came over. But I was like, so we got one option, and we just got to really hope that this one option is available.
Yeah.
And this brother also has, like, a very full life and kids and whatever. And so it just was an interesting. And so to finish that story out, like, Adam did come over and I did go to the party and whatever. But like, what I did for that was, like, I did all of the work. I did all the hard things beforehand and after.
Yep.
It was more just like, I need a person here in case he needs to, like, get up and move around, or he needs this or whatever. But it was like, they just sat and had a grand old time. And I did say, like, Adam, I'm going to put you to work. You're going to take out the garbage. And Amy's my brother-in-law, so I can say that. Right. But for that, it was more like, I did all the hard work on the bookends. And then I was just like, I've done the work. You just get to come and sit here. Right.
Yep.
But so back to that for a minute, I think that is a challenge. And I've heard people say that in the past so often, like, well, my person doesn't want anyone but me.
Yeah.
And I've always wanted to be like, too bad for them. Right. Like, but when it was my person
right.
saying like, I love all those people, but I really don't want them in our house right now because I don't feel well.
Yep.
And then I was like, well, crap. Then what? How do if we only have one option?
Yeah.
And, and so that was an interesting, and I was certainly like, if I had said to him, look, I really need this, he would have said, of course, sure. But, he is, we've talked about this. He's a peacemaker. He's a number 9. He doesn't ask for much. And so when he says like, really the only person I want is my brother, it was like, okay, I got to listen to that.
Yeah.
But like at what point, like whose needs.
Right. And,
when
that's an espousal dynamic. And, if it's you're caring for your parent or someone else, like it's a different dynamic there to where, that could make it even more challenging.
Right.
Yeah. That's tough when, we can do all the work and, what do you do if your person's like, no, I don't want them here or I'm not comfortable. Because it's like on the one hand, like they've given up so much of their autonomy and it's like, you don't want to further take that away.
Right.
But you also need this.
Yeah.
And it's like a bind and I don't think it feels good for anybody in that situation.
Right.
I wonder if this is an area where, again, if earlier on in the process, like one or two other people are involved or to kind of prepare for this kind of role to where they know a little bit more what's going on, that could be an option. And I think having maybe a conversation when things are not at the crisis point with the person you're caring for and like, hey, there may come a time when I need to be gone for a period of time. And, it could be for a variety of reasons. It could be, your job requires you to like travel or something, or, you have a family member across the country who passes and you need to go to a funeral or something like that.
Right.
And so what can we do now to set us up for that? Is there someone who potentially you would feel comfortable that we can kind of help them know what's going on, kind of get a feel for that? Because things are always easier to sort out when you're not just like completely drowning in over your head. That's never when we are able to do our best work. Yeah. Right.
Well, and for us, it was like a surgery date and we knew it was coming, right? For so many people, it's, a decline or it's an event or it's a whatever. But I would guess that if preventatively I had that conversation, he would have been like, oh, so many people I would be fine with. You know what I mean?
No, that's true.
But then once he was like really not feeling well, and in the early days, we did have like Megan was here a lot. My mom was here a lot. Like I was like, I need help. In the house with me.
Right.
And I didn't even ask too much for permission from him. I was just like, this is what I need. But I think when it turned into more of like, I'm leaving, then he was like better enough to not be like in an emergency mode of just like, whatever, if it's fine, but didn't feel well enough to like have anybody, somebody a while ago. Cause part of it is, if it's so kind when it's like, someone's like, I'm going to drop off dinner or I'm dropping off this, or like you order the groceries or you order the dog food or you whatever, but just the alertness that you need to have for all of those moving parts. And when you're in crisis mode, I at least try to like take little naps anytime I possibly can. If it's like he's sleeping and I'm asleep, but then I'm like, I have to stay awake because these groceries are about to be, or this lasagna is going to be on our steps. And so I had a friend once who said, I would be happy to just sit in your house and answer the door and answer the texts. And which I was like, well, that's beautiful, right?
Yeah.
Because sometimes it's like the doctor's going to call and I really want to turn my phone off, but you know what I mean? But sometimes it's like even that, like when you don't feel well, they don't feel well. Like it's just like even having another presence in the house is just like, ugh. So even with bringing in skilled nursing.
Yeah.
Like this time, I don't think we had the option, but a previous surgery that was like this, we did have that option that like skilled nursing could have come in and done all the wound care.
Mm-hmm.
And we were just like, you know what? It feels harder to like schedule it and have the person in the house and and not know when they're coming. And then I can just do it myself. Right.
Yeah.
But like, so there's all these like handoffs that, so the scheduling and everything's annoying. But then I still think about that wound care I had to do. And that was like 9 years ago or whatever,
right.
you know?
Yeah.
So, yeah, I mean, it's complicated.
Yeah. Well, and when you're talking about like a professional service, like there is that feels like an escalation or a like really coming to terms with the gravity of the situation that like I need like skilled nursing in my home.
Right.
Or that's the alternative to me. It can be like, right?
Right. Yes.
Acknowledging like what you are doing. The level of care that you're providing.
100%.
It's a lot.
It's a lot.
Yeah.
Well, even my friend Megan again, like was helping me prepare for the surgery and said, what if you thought about putting Sean into like a transitional care facility after the hospital,
right? So
that somebody else can do all that wound care. And she's like, and then you can rest. And it just felt like, what? Like part of my brain was like, well, I guess that makes sense. But it also just felt really like cruel to be like, technically you could be at home in your own bed.
Yes.
But because I'm tired, and so I do know that like another option for respite is there are respite facilities where a person can go.
Yep.
And, I have known people who have done that in the past, and it's just, it's hard. It's hard because I think that often the person, the person with the illness or like, struggle, and I'm sure it can work, but I just think and I don't know the solution here.
Yeah, right. Yeah.
I am not trying to say don't use respite services. I'm just trying to say that it's not as easy as, hey, are you taking advantage of that? Whether it's a family and friends or it's something professionally, somebody wrote in and said they've used it, but what they struggled with scheduling. Their parents, they used it for their in-laws. Their in-laws' lack of trust in a stranger, which I totally can imagine. And then personality conflicts. Right. And so I'm sure like if you get somebody from a agency,
you don't know who you're getting.
You don't know who you're getting and all of those things. And if you're most vulnerable and you're not clicking, right, that can be really tricky.
Yep.
Another person also wrote that it's hard because the person is nonverbal. And so then they have to have a lot of trust in the person, the respite care person, because their person can't communicate and share if anything went wrong or, you know what I mean? If they felt unsafe. And so that's a whole other level and layer,
Well, yeah. And like when Sarah was bedbound, she had kind of a rudimentary like sign language sort of for communicating certain things
that you understood,
that I understood.
Sure.
And that's another thing you gotta document. And how do you explain that? And it's a mess. So did you get respite?
Are you wagging your finger at me?
No, I'm just curious.
No, I'm teasing. So I did, and I went to that graduation
party.
Okay.
Yes.
Yep.
Yeah. So just you went to that graduation party, and I think it's good to acknowledge that is a break. That is respite. Like this doesn't mean like you're taking a trip. This doesn't mean you're like sleeping for a weekend or whatever. Like
it's 2 hours,
getting
3 hours.
2 hours here, 2 hours there. Like that's great. That's a win. So,
and I think in some ways that's actually a more sustainable win.
100%. Yeah.
Is taking these little breaks as opposed to like just leaving and then coming all the way back. Right. But it was interesting because, I went to this graduation party and so I like showered and got cute looking and like got in the car. And as I drove away, I was like, whoa, like, this is, whoa, amazing. And so it felt very like, oh, like there's a whole world out here. I'm trying to think. It was maybe like 2 weeks in or 3 weeks in. And it just, as I was driving away, I felt like I was in a movie scene, just like, wow, watch me go. But then it was interesting, like being out in the world and being at this totally different setting and scenario and just having conversations, you know, in a totally different way. But then it's like, you got to go back. So that's why I wanted to put the pin in the thing, right? It can also refer to the postponement of a punishment or an obligation was the other part of the definition, right? And so I'm not saying that taking care of my husband is a punishment, but you know what I mean? Like or an obligation, right?
Right.
So it's a break, but it's still waiting for you. And so it was sort of like the driving there as opposed to the driving back home was like, oh no. Oh, it's still waiting for me. And like how, you know, fortunately we weren't in a spot where I was like, where I think a lot of people are when they have respite, where they're like, now what mess am I going to have to clean up?
Exactly.
Either like literally or proverbially, like what happened while I was gone?
Yeah.
What kind of terrible, you know what I mean? All of those things. So it felt good to like do it, but also then it was like, whew. So I tried to, for a while, figure out, because also you just never know, like, what's the day going to look like? And so to line somebody up. So I tried to figure out, are there like little places close by enough that I could just like zip, you know what I mean? Like, this isn't my favorite garden store, but there's a garden store that's like half a mile away.
Right.
Can I go there, walk around for 10 minutes and come back? Can I go around the block?
Yeah.
Can I, you know, just go get a coffee from the coffee shop that is like, you know, just to get like be in a different environment.
Yeah. I mean, getting out of the house.
Yeah.
Because like not having a ceiling or a roof above you. And like, I don't know, for me, that's like, I don't know if energizing is the right word, but there's something about, okay, like, it's calming. It's like grounding. It's, I think it's important. Yeah.
It is for sure. Yeah. And so just just different, your eyes looking at different things and just taking in different things. So I eventually just figured out like what are teeny tiny respite things that I could do that were so small that I didn't actually need like coverage.
Right. You could get back quick enough.
I could just go and come back. Right. Instead of that. And there was something else. I can't remember what I did, but there was something else where our daughter came and hung out with Sean. And again, they were moments where it was more like, okay, he's probably okay, but his mobility is still a little iffy. And so I just feel better if somebody was in the house. But again, you know, what's interesting is that with both of those, they were events. You know, it was like graduation party. Oh, it was like an event I went to with a friend for her birthday. And so which helped because it was like something on the calendar.
Right.
Do you know what I mean? Like it made me think like that graduation party is coming. I want to be there. I'm going to make this work.
Yeah.
This birthday thing is coming. You know what I mean? And I think that having something on the calendar can really be helpul. Because otherwise, the days just go by,
and you forget about it until like the 2 days before, and you're like, "Well, yeah."
Well, or like the days just go by, and you just off you go, and then you never get any kind of break.
Yeah, exactly. Yeah.
So I think like scheduling it, can feel helpful. But I think that like as we get into, I mean, let's be honest, there are not like solutions here, right?
Yeah.
But I think part of it is for me was redefining what it meant. And just taking it in little, like, you know, we used to talk about like micro moments.
Yep.
These little tiny bites. And then thinking about like, okay, like what would it look like to have somebody else in the house? And like, you know, maybe thinking now that we're in a quiet moment for this hot second, like having a conversation with him about like, hey, the next time we're in the weeds, I'm going to need your list to be longer than one person.
Right. Yeah.
So how can we think about that in this calm moment? So that I have more options.
Yeah.
You know? Yeah. I think the other thing that I'm finding too is that there's two different organizations that are local, but I'm sure there's other ones that are private pay, but
what do you mean by private pay?
Private pay as in it's not the kind of thing where like you have to have a voucher or you have to qualify.
Right. Okay.
It's just like a
you
local
call them,
business.
they come, you pay the bill.
Exactly.
Yeah, okay.
So it's just cleaner. And I mean, it's hard because there's not like vouchers, but it's cleaner because you just call them and
there's
then
no
boom.
Additional paperwork and
exactly.
Yes.
So one is this group where they come and like they just do anything you want.
Okay.
For like 3 hours. So it could be like, I want you to clean my refrigerator. I want you to take my elderly person to Kohl's and wander around. So there's things like that I think services like that are sort of like elder care or whatever. And it doesn't have to be elder, right?
Yeah.
The trick with those is that because they're not like medical professionals, then they often don't do like bathing or like bathroom things or, but if it's like, hey, will you come play chess with my person? Will you whatever? And then those are people who can do some of those things. There's another person I know who supports a family on our street, and he has that same kind of service and does anything for them. So again, it's like anything but medical.
Right.
So they have another person who can come in who can fill the pill boxes and administer the medications, but he does everything else. Like he says his job is just to like make people happy and like keep them happy. And so I think that there can be services like that that can sometimes fill in the gaps. And I want to recognize that those you have to pay out of pocket. Yeah. Right. And that is obviously not accessible to everyone. And in some ways, sometimes like by the time you go through all the paperwork, you know what I mean? So, yeah.
One thing that I've thought about through this conversation is when Sarah was really sick and I was working in the office.
Yeah.
In a strange way, like going to work, going to the office was respite.
Yeah, for sure.
In kind of a non-traditional way. And, it was using a different part of my brain. It was a different sphere. It was a place where I had more agency and control over, what was going on moment to moment.
Yeah.
Which was really good and may have been a thing that helped me like persist through that, those years. Right.
Yeah.
But the same thing, like you were describing the drive to the event and the drive home from the event, like that's a daily occurrence at that point. Right. Yeah. You have your morning drive and you're going to work and it's not always the best to go to work, but the drive home, it's like you don't know exactly what you're coming home to and to what extent you'll be able to, take off your shoes, have a seat, kind of like relax for a few minutes versus like come in the door, boom, you're on.
Right. Right.
And that's tough to have that level of uncertainty.
Yeah.
And like you said, with the secondary definition of like returning to an obligation or something, it's like that can be difficult with respite, I think, is even if you have someone you fully trust caring for your person and like everybody's on board with it and everybody's comfortable with it, you're going back to this very hard thing.
Yeah.
And I think it can be difficult to let yourself relax, to let your body unclench, knowing that like within the back of your mind, like, today's great, but then how long until I can do this again?
Right.
Right.
Or like you said, what are you going to find there? Right. Like if you're in the house, you're like seeing, you got your tabs on everything. But if you're gone for however long, like, what's it going to be like when I get home? I think often about something you said on one of these episodes about when you went off to like a brewery night or something and then came back. Oh, I think it was about like you went off and you were with your friends and you were talking to people and then you came home and just like the shift of like getting home and just being like, and you and I, we love our people, right?
Absolutely.
It's not that.
Yeah.
But it's the situation that you're walking back into and that the sweetness of being away from it and being like, I'm a different person.
Yeah.
I'm not just a caregiver. I'm the, and then coming back into it is like,
that reentry. Yeah.
Yeah. 100%. Yeah. So I do want to make clear that I'm not saying people shouldn't access official respite services.
Yeah.
I think that the systems, we got some work to do.
Yes.
On the systems so that we can make it as easy as possible. And I'm excited to know that like places like Iona Care are there to be like, we'll do the grunt work. Right. So I think a couple summary things before we get into supporters is like one, like you said, like what can you do early on, either preventatively to either set up the systems to make the directions clear for like anybody who walks in the door, to talk about like who or what might this look like, and like to set it up beforehand and to sort of like build it in before you get to like the breaking point. And to know that like your needs are important too. And so to say that at a quiet moment, like I'm going to need a break too. I know you might not love that, but you love me. I need this. So it's going to happen,
Right.
Yeah.
Yep.
So you said like the most beautiful sentence ever that supporters can say. What else do you think supporters can do?
I think another thing, I mean, it's sort of related to what I had said earlier, but you may see that your caregiver you're supporting or someone in a place where you think that respite care would be helpful for them, right? They probably already know that, right? And they know all of the barriers and reasons why that's going to be so difficult. So rather than suggest that again or make that all you do, just a quick comment is like offer real things that you can do to help them. Like offer the meal, offer the groceries, offer to clean their house, offer to mow the lawn, offer to rake leaves, shovel snow, whatever it is. Because yes, the situation may be such that the medical stuff, it's difficult to hand that over. But all of the household tasks that just have to keep happening, if those are handled by someone else, those are easier things to hand off.
Yeah.
Those will lighten the caregiver's load. And it's not like, I don't know, maybe that's like partial respite. I don't know.
Well, it's like it creates a buffer.
It creates some space,
in the caregiver's
kind of. Yes.
Day. Yeah, for sure.
Especially, and maybe that's something, if you're doing that and like long term or sooner, then that helps the caregiver not get into the state where they are completely burned out, right?
Yep.
So that's one thing. Another thing that I thought of as kind of a non-traditional, maybe respite sort of thing is offer to like, okay, let's say you have a friend, right? And they say that they see that you're exhausted and they're like, why don't you have a night where you just hang out with Sean? Maybe you guys watch a movie together or something. And I'm going to take care of all of this stuff in your house so that you don't have to like take this night off knowing that you have to catch up on all of these other things. And the two of you can have some time just to hang out together as a couple, because that's something that when we've talked about that, how that can be a challenge when in a spousal situation where there's a caregiving dynamic, is like everything feels medical, right?
Yep.
I don't know. So that's just another idea that I had. And I don't know.
Yeah.
There's probably similar kinds of things, but you can be a little creative.
Yeah, absolutely. There's certain things like taking out the garbage and the recycling, which I don't know why, but I just hate it. I just hate it. And I would love it if just somebody was like, I'm just going to come over at noon and any things you need me to do, I will do. And for a while during the like super heavy times, like my mom came over every day. And so I just had a running list. And she'd walk in, I'd be like, here you go. And it was just stuff like that, like break down the cardboard boxes and you know what I mean? Take out the garbage and whatever. And it just was stuff that I like her doing that, like took that out. So I didn't leave, but like she came in and was able to do those things. So I think, yes, or saying, you know, like this friend said, I would be happy to sit, you know, so many people work remotely. So like I could work, I'd be happy to like work remotely, sit in a quiet space in your house and just be there to like answer the door, answer the text, because a big thing for us too was like letting the dog out. Like when Sean wasn't mobile, I was like, what about the dog? You know? And so like if somebody said I could just sit quietly, nobody has to talk to me. I think that's the other part is that Sean kept feeling like he was going to have to entertain or he was going to, you know, find himself entertaining these people. And so to say like, and nobody has to talk to me. Nobody has to, you know, like I'm just here. So I think that's a beautiful offer.
Yeah.
And I think to find because I feel like this friend who was offering after a while, like almost made me feel guilty. Like, Allison, you're not taking me up on this offer and you are exhausted.
How do you handle that? Like,
and I was like,
the relationship basis when you, either you or your person isn't comfortable with someone and they're offering, like, how do you manage, navigate that? And that's another thing. That's more labor you got to do.
Right. So support her, just like, hey, here's the thing. Like, don't like turn it into like, you're not taking respite. Right. But instead, hey, I imagine that here's the thing. I'm available on this day, whatever. Right. Yeah. But I love what you said earlier about like, I know there are programs available. Would you like me to do some research or how can I like do some of that? You know, whatever.
Yep.
The other thing I just assume, but I want people to say is like, don't clean your house for me, or don't like if there's someone coming into the house, you know, I want them to just be like, it's all great. You know what I mean? Like, so that I don't have to feel like I'm like cleaning for the person who's coming in. You know what I mean?
Yes, 100%. Yep.
And I think also I was so nervous that like if we asked Adam, like if Adam was our one person on our list and I asked him and he said no, which he very likely could have because he has a very full life.
Yeah.
Then it would have been like, oh. And so I wanted to be like, this is a really big deal. Can you please say yes? But fortunately, he was like, you guys are my priority at this moment. Of course, I will make it work.
Yeah.
So I think that's the other thing is if a caregiver is asking, like, please do what you can. Like, you can't always, but like prioritize that because it was a lot to ask. And if somebody says no, if you say no to them, there's likely they're just going to be like, well, that didn't work. I guess I'll just do it myself.
Yep.
Yeah. So prioritize it when you can.
Yeah.
Yeah. Yeah.
Yeah. And then, fix the systems.
Yeah. Just in your free time.
Right.
Go fix the systems. Yep.
If that, and maybe that is something you can like advocate for and, pursue and push for. But, just be aware that it's often not the caregivers. The infrastructure is non-existent. And,
yes.
Yeah.
Yes. Yes. So thinking about places like Caring Across Generations that we've talked about in the past, like getting involved in, if that's like your jam, get involved in something like that, support her and try to like fight for some of these things.
Exactly.
And I've mentioned the guide program a couple of times. I'm certainly not an expert on that, but if you are listening and you're a caregiver of a person who has dementia, just Google it. Google Guide Medicare.
Okay.
And you'll be able to see like, do they qualify and all of that. Because it's a good step for us as caregivers that it exists, and we kind of need it to be successful to be able to, for them to say like, oh, people are using it, so that more programs like this can continue. Do you know what I mean?
Yeah.
Because if nobody uses it, they'll be like, well, we tried to help caregivers and nobody used it.
And if you're a supporter of a caregiver for someone with dementia, also maybe look it up and see if they qualify.
Yep.
To as much as you can determine, and you can help them access that service. Yeah.
Yeah. And you can go to IANA Care, which is IANA Care, and see if they support people who are in certain states and zip codes.
Okay, great.
With it. And so Guide is across the country, but IANA Care helps certain folks. And so I would look there too, because then you get their support with all of the paperwork and everything too, which is amazing. So
great.
Yeah. So good to be back with you.
Oh, this has been amazing.
Yeah. And my life will just keep giving you, we've got more fodder, so much fodder for the podcast, but good to be with you. And thanks for talking Respite. And
all right.
Yeah, we'll talk soon.
Okay.
Bye.
Bye. You've been listening to In Sickness. Find us online at insickness.care or on Instagram at insicknesspodcast. You can send your questions and comments to hosts@insickness.care. If you enjoyed the show, please share it with a friend or fellow caregiver. Thanks for listening and take care.